Dear students, my name is Beata Dobrowolska. I represent Medical University of Lublin in Poland, and in this lecture I would like to talk about evaluation of spiritual interventions. As you probably know, as nursing students, nurses worldwide work using method of nursing process. This method consists of 5 steps: assessment, diagnosis, planning, intervention, and evaluation. Working with this method, nurses can assist patients in meeting their spiritual needs. You have already learned about spiritual assessment and planning of spiritual care interventions, and during this lecture we will discuss how the spiritual nursing care provided to patients and family can be evaluated. Evaluation as the last phase of nursing process is mostly about checking the effectiveness of interventions made by nurses regarding spiritual needs and achieved outcomes. At this stage, we should answer the question, what has changed? When comparing the patient condition at the time of spiritual assessment with the time after the spiritual interventions were implemented. To be more precise, we are evaluating indicators of spiritual outcomes, which can be very different depending on problems diagnosed in this concrete specific patient. Among many indicators of spiritual outcomes, we can report spiritual integrity demonstrated by tranquility or peace, development of meaningful, purposeful behavior, and relief from spiritual pain. Additionally, as more indirect indicators, we may mention also better cooperation with nurse, with healthcare personnel, because based on trust and adherence to treatment or care procedures. Considering the nursing process has cyclic character, what means that evaluation is often the beginning of the new cycle of nursing process, monitoring of the effectiveness of spiritual interventions is a continuing process. There are different methods of evaluation that can be used by nurse, and one of the proposition is the Ross and McSherry two-question spiritual holistic assessment model, so-called 2QSAM. You probably are very well familiar with this model, but I would like to talk about it shortly in context of evaluation of spiritual care interventions. The main advantage of this model is the continuing assessment of the patient's spiritual condition needs with the first question, what is most important to you now, and possible interventions to be implemented according to patient's preferences with the second question, how can I help? Asking patient these two questions systematically, we make assessment of his or her spiritual needs, address them, and at the same time evaluate achieved outcomes. Additionally to these questions, we should supplement our evaluation by an observation of patient behavior and also by compassionate communication with patient and his her family to find out whether action undertaken by nurses to meet diagnosed spiritual needs were effective and what outcomes were brought. As you already know from previous lectures, each nurse should be able to recognize her or his own boundaries and limitations in providing spiritual nursing care, and to have confidence to refer to other healthcare professionals where additional spiritual interventions and support are needed. This is specifically important in case of unmet spiritual needs. If they are unmet, it probably means that we should seek help of another professional, maybe more competent in the scope of spiritual care. We can talk about three main types of evaluation of spiritual nursing care process. The first type, it is the professional evaluation. This evaluation monitors whether the intervention took place and what kind, if it was within nursing competence or required referral to other healthcare professionals, what outcomes were achieved, and how patient or family feel with it, whether other professional action is needed and what kind. What is important in this evaluation, it is a discussion within the healthcare team to analyze the impact and the effects that the spiritual care has had on the patient's spiritual pathway. The second type of evaluation, this is the organizational evaluation, which checks whether what kind of barriers, if any, were noticed in the process of delivering spiritual care, what helped and what should be changed in the future actions of this kind. And finally, the third type of evaluation, this is the personal evaluation. This is the kind of reflection of a nurse asking herself or himself a question, how I felt about the situation, whether it was comfortable for me or not, and what was the most difficult, if anything. Obviously, the results of evaluation should be documented, as every action undertaken by nurses in nursing process. Documentation of patients' spiritual needs, intervention, and evaluation of outcomes is also the issue of recognition of nurses' work, as well as recognition of importance of spiritual nursing care. Through documentation, we can report how the condition of patient may change when providing spiritual care, and what influence it has on patient condition. Spiritual care documentation facilitates that the follow-up of patients becomes clear for everyone working with the patient on an ongoing basis. Documentation maintains continuity and allows for observation in changes in condition over time. This becomes especially important where there are limited or no verbal handover practices, and each student, nurse, midwife may have to read the written reports themselves to gain an update about each patient. What is more, documentation should be written so that the patient's integrity and confidentiality are maintained, along with stating the interventions and what needs to be followed up. There are different systems of documenting nursing care process. You probably are familiar with NANDA model or ICNP model, and these two models may help in reporting nursing spiritual care. I hope you found this lecture interesting. Thank you.